health leaders say while that decrease in youth suicides is not statistically significant, it does indicate that some of the things the state has been doing to prevent suicides are working.
We're always hopeful when we start to see a decrease, but that's an opportunity for us to understand which prevention strategies are working, to share a message of hope.
Dr. Lena Heilman is director of the Colorado Office of Suicide Prevention. She's also someone who knows personally what it's like to lose someone they love to suicide, having lost her sister Danielle in 2012.
And so I know that whenever we look at data and data sets, we're really looking at human lives that have been impacted, family members, community members.
Her office helps provide funding and training for suicide prevention programs across the state, and they've been expanding their reach into more schools in recent years.
So we work closely with our partners across the state because we all have a role to play.
So far this year, 35 young people have died by suicide in Colorado. Heilman says adults should establish an open line of communication with the young people in their lives.
And one of the strongest protective factors in a young person's life is a trusted adult.
She says young people having someone to talk to about their thoughts and emotions can go a long way in preventing tragedies. In Denver, Brandon Richard, Denver 7.
Thanks, Brandon. And nationally, suicide deaths have reached record highs. So taking a closer look, the pandemic's impact is lingering. New numbers from the CDC show a record-breaking 49,000 Americans took their own lives in 2022. More than 1,000 of those right here in Colorado. Suicide deaths rose nearly 7% in people ages 45 to 64 and more than 8% in people 65 and older. Sarah Hanchett with Evolved MD says even with expanded prevention resources, demand is overwhelming.
It affected everything within our lives. Job loss, loss of life, loss of family members, loss of homes. So much grief and loss takes time to work through that. There's a bigger need for resources for mental health services across the board.
Definitely. And some more context here. Between 2011 and 2022, more than 500,000 people in the U.S. lost their lives to suicide. But in the first year that suicide hotline 988 was launched, nearly 5 million people in distress reached out to the organization. So if you or someone you know is experiencing suicidal thoughts, please, you can speak to a trained mental health counselor right now. Just call the National Suicide Prevention Lifeline at 988.